Hello, I'm Dr. P.T. Thomas, UNIMAS. We'll continue with the examination of the seventh cranial nerve, which is called the facial nerve. So, facial nerve is the function is all the muscles of facial expression. There are several muscles. We'll not be testing all the small muscles, but we'll be testing only the main muscles. So, we'll look at the function, whether the muscles are functioning or not. Then the other sensory function is the sense of taste, which is at the anterior tooth of the tongue on each side. And if there is a paralysis of the seventh nerve, which is a lower motor neuron type, or if there is a lesion in the facial canal, it has got other symptoms like the hyperacusis and loss of taste. But if it is an upper motor neuron loss of function, that will affect only the lower part of the face. Just like in a stroke, along with the limbs on the same side, the lower face also is usually weak. Now I will show you how to examine the muscles of the facial expression. So first is the muscle which elevates your eyebrows, which is called the occipitofrontalis. So will you please look at my finger? So you can see the eyebrows go up, and there may be wrinkles on the forehead. Some people may not have wrinkles. Second is, can you close the eyes tightly, and do not let me open even if I pull it. So if the eyelids close very tightly, of course you will not be able to pull it open. Okay, please open. Then the third is whether you can smile like yeah. So this is the zygomaticus muscle. Then whether you can close the mouth tightly, like, and puff the cheeks. So when you press the cheeks, it should not leak also. But of course, if you press it hard, of course the air will leak. So this is not a very strong muscle, but not stronger than the eyelid muscles. And the next function is I have shown the smile and the closing the mouth. Then there is a muscle here which is called the platysma. As you can see, when you do like this, you can see the contraction of the platysma also. And if you want to test the sense of taste, that needs a lot of preparations, and you have to prepare the basic taste like the salty solution, salt, sweet, sour and bitter. And it should be written down on the paper so that just like this. You have to write down on a paper so that the patient should be able to point what taste she is feeling. And for this, it needs a lot of preparations, and it's just not usually done. But if you want to do it, you have to prepare the solutions, and with the swab stick, you have to apply the solution on the edge of the tongue. So please open the mouth and protrude the tongue. Then you have to put it on the edge of the tongue, and the patient should not close the mouth but point to this and say which taste you are feeling. Of course, we are not doing it, but this is the method. If you need to do it, you have to do it like this. If there is hyperacusis, of course the patient will complain that the sounds become very annoying on that particular side of the ear. So that's about the facial nerve. Thank you.